Paradigm trial, Dmhf trial and Paragon trial. You know the two important trials are the Paradigm Dmhf and Paragon trial of these circumvented pulse and heart failure outcomes trials. The heart failure and renal outcomes in patients treated with GLP-1 agonists. A very interesting outcome subject is GLP-1 agonist. GLP-1 agonist is a very outstanding subject regarding management of heart failure. So evolving biomarkers as a tool for the early detection diagnosis. You see the plasma biomarkers, BNP and NT-proBNP levels increases as heart failure worsens, and monitoring of these levels has become a standard method for identifying heart failure and determining the severity. It's very teaching to us when every day dealing with NT-proBNP regarding management of heart failure. And this is a diagnosis accuracy of natural peptide. This natural peptide is very important. You know that NT-proBNP we have already discussed. Again, NT-proBNP, then diagnosis accuracy of natural peptide. This is also discussed. The strong HF studies. This is a very important study, strong HF study design. They have shown this NT-proBNP level and they have summarized, objective summaries of the we summarize all of the stories of the HBNP. Then summary will find the higher NT-proBNP levels were associated with a greater risk of clinical outcomes in the overall heart failure. NT-proBNP appears useful as a risk stratification in patients with heart failure. The relative risk reductions of all the outcomes with sacubitril valsartan were consistent across the NT-proBNP level. The benefits of sacubitril valsartan were similar irrespective of NT-proBNP levels. The subgroups and by baseline characteristics from the NT-proBNP level. They are very important select trial. This trial, heart failure and GLP-1 agonist. This is very, very important conversion role in our medical field. In our field, this select trial, this shows the web trial, this with GLP-1 agonist, particularly this semaglutide. The semaglutide, these trials are the select outcome trial, heart failure trials, so they select trials, and they show is very important for the semaglutide. The Lancet, this semaglutide and the cardiovascular outcomes of patients with obesity and prevalent heart failure in special analysis of the select trial. The select trial they show this semaglutide and the cardiovascular outcome trial, and they show the very interesting findings also. They show the different effect of semaglutide versus placebo as presence of the absence of heart failure enrollment. And this is the entire study. These studies they show this cardiovascular complications for TTVM, and they show this semaglutide particularly, the reduces the cardiovascular mortality. And I think one of the important drugs in the future is semaglutide according to select trial. There is a very important message come from years 2024. Then cardiovascular involvement in the diabetes mellitus, everybody knows. One of the important complications of heart failure is the diabetic patient. So the diabetic patients, particularly one of the most important complications, they die from this heart failure. And these heart failure patients, they are benefited from upcoming studies on the DRAS, this SGLT2I. So SGLT2I is another important drug, SGLT inhibitors. We are using every day to day our life in heart failure trials, and diabetes particularly. These dapagliflozins and empagliflozins and canagliflozins, they show these important trials, the heart failure trials. These trials also show this important trial, particularly this important SGLT inhibitors. They show the guideline directed medical therapies on heart failure. This is a very old trial. This is a very old slide. They show how they were management of heart failure. And the newest anti-hyperglycemic drug SGLT inhibitors. These SGLT inhibitors, how does they act is very clear. SGLT to the receptors, and these receptors they blocks the sodium is glucose transporter system, and the glucose going out in lieu of reduce the glucose absorption from the gut. The glucose is out from the renal tube. This is the basic mechanism of the SGLT inhibitor. And this SGLT inhibitor inhibits lower severities in diabetic patients without severity. With that is very important. Without severity, we value of SGLT inhibitor and severe outcomes. So very important trials, empiric trials with the empagliflozins, canvas trials with canagliflozins, and the declared severe trials particularly dapagliflozins. So this is a very important trial of the dapagliflozin declared the trial. They show this reduction of heart failure morbidity. This DAPA high heart failure trial This is a very important trial. This is DAPA heart failure trial. With the DAPA represents they show the reduction of the heart failure trial, particularly DAPA represents study. And the outcome is Empire trial and the Dmhf trials, Canvas programs, the declared timid trials, and the Wattage trials, and of course the modern, the update study, the DAPA kidney trial. They also show all these shows these heart failure mortality studies. So practical considerations of the use of SGLT inhibitors. This is very important. We know these SGLT inhibitors, of course, they reduces the ejection fractions, and you know these DAPA glucose can be used as eGFR as less than 20. So this 20 is the these markers, and the more than 20 they should be used, and less than 20 is eGFR they should not use of these molecules. Aging the cardiac glucose, DAPA glucose, and MPA glucose advantage of the molecule insulin independent of the glucose reduction of levels, low risk of hypoglycemia. Everybody does not weight loss is very important thing to do. So up to 40.4% are the body weight reductions with these SGLT inhibitors, body weight loss of body weight, and then blood pressure lowering also is there. Then once daily insulin, once daily effects of effects of insulin resistance, and this also shows the styles effect of independent of insulin resistance. So this severe analysis is very important. This disadvantage also very clear. These fungal infections of the urinary tract, GI urinary tract, and these bacteria that are fungal infections, osmotic diuresis, dehydration, patients should not be given SGLT inhibitors, increase LDL cholesterol. This is a very controversial issue. Hyperkalemia. Hyperkalemia is also a chance there. Bladder cancer, DAPA glucose is very worrying. Glycemic decay. This is very important that our potassium and canagliflozin, this is a controversial studies. So potassium mechanism by which there is very important slides, and the evolution is inhibitor arterial management. This is trial. This SGLT inhibitor only benefits of prevention of cardiac complications that with diabetes present. And this shows the conclusion we can say diabetes is a manufacturing disease. We can prevent the progression to heart diabetic complications, particularly heart failure and kidney failure, by using the newer drugs as SGLT inhibitors. It's a very newer drugs, and these GLP-1 analog and SGLT inhibitors. I think these two drugs is very important in the management of heart failure with diabetic patients. Thank you very much for your kind participations.